Hi, welcome to part 4 of our series on polycystic ovarian syndrome. In this episode, I'm going to discuss the most common form of PCOS, what I call garden variety polycystic ovarian syndrome. This is the most common condition I see. A woman with garden variety PCOS might have periods that come between every 1, 2, 3 months. Sometimes they come monthly. Sometimes they stretch out to every 2 or 3 months. They rarely go long durations of time without some type of period. These women are typically a little overweight, maybe 30, 40, 50 pounds overweight. Almost all of them, depending on their skin type, have some type of bothersome hair growth or acne, but it's manageable. A little plucking, a little waxing or something, some topical acne products are generally all that's required, and it's generally not disfiguring or horribly bothersome to these women. These women frequently have a large frame. How you measure your frame is you see how big your wrist diameter is. If you can reach around, it's average. If you can't reach around your wrist, you're probably large framed. Now, women come in various shapes. There's generally the pear-shaped woman and the apple-shaped woman. Women with garden variety PCOS can be a mix of both. I mean, women can be pear-shaped with a small waist, but generally they're kind of mixed with weight distributed in the belly and in the thighs. Now, along with garden variety PCOS, we frequently see mild hypothyroidism or low thyroid, but these women are usually not, frankly, diabetic. They may have tendencies, but they generally are not diabetic. When we do ultrasounds on these women, generally their ovaries have polycystic features. That's probably one of the most common things we find dependably. Now, we're going to start talking about the genetics of PCOS and the adaptation of these genes for various environments. Like I mentioned before, we didn't always have supermarkets and freezers and the ability to get food from the southern hemisphere. Droughts, plagues, wars, all these things happened with great frequency in the past. Women with garden variety of PCOS are probably adapted for moderate stresses, not severe, lengthy ones, but enough times of stress and food deprivation and other things that make these adaptations favorable. When women with garden variety PCOS experience some food deprivation or something like that and lose weight, frequently fertility comes back. In fact, women with PCOS of the garden variety generally need to only lose about 10% of their body fat to see a dramatic change in their metabolism and their ovulation. So a loss of only 10% body weight generally will jumpstart ovulation, and fertility generally rises very, very quickly. It's important for women with garden variety PCOS to realize they do not have to reach ideal body weight. We're not going for runway model skinny. Women with PCOS of this type generally have larger frames, as I alluded to, and generally a normal, healthy walking around weight will be 20, 30 pounds heavier than the chart says she should be. So, fear not. If you have garden variety PCOS, you do not need to lose tons of weight. Generally, you only need to make some small, general, persistent changes in your diet, some slight increases in exercise, and if we've ruled out other more severe hormone problems, generally it's very well managed and good things will generally happen. So, that's the most common form of PCOS. Garden variety.